Hi, this is Gwen Davis of Mind and Body Fitness Connections, and I'm continuing my series on the myofascial continuities. Today we are going to talk about the superficial backline, but be sure to go back and watch the intro, which really explains what the fascial system is and how it is affected with the muscles and various nerves. So today, talking about the superficial backline and massage. Now the superficial backline, as we're going to demonstrate on Jehaven here, actually houses a variety of different muscles. It starts at the bottom of the foot, so it includes the toe flexors. It moves up into the calf, including the gastroc muscle, the hamstrings, which there are 3 of the hamstring muscles. Then you've got the ligaments that are into the pelvis, and then the back muscles called the erector spinae, which run on either side of the spine, moving up to the back of the neck, and then the epicranial tissue in the head attaching at the brow. That is, like I said, called the superficial backline. Now, in order to do massage to this, you're actually going to do some myofascial massage in order to affect the fascial system. To do that, you want to have long holds, and you want to have slow, deliberate movement patterns to help separate these fibers from the other surrounding tissue. So for instance, we'll just start here at the hamstring, although if you were actually doing this, you would start down at the foot. Again, the toe flexors here, moving up into the gastroc. But again, for today's purposes, we're going to start here at the hamstring. Now, because these bags house different muscles, and the fascial bag of the superficial backline houses the entire hamstring muscle, what I try to do here is just some holding, like I said, and then some thumb walking. So for this, I would start out at where the hamstring attaches just below the knee and do some thumb walking up to the belly of the muscle, separating those fibers. And you can feel that, when there is some congestion in the tissue, you can feel where it is created kind of this crisscross pattern. So muscle tissue is actually striated, meaning it's going to be running ideally all the same direction. Whereas with the fascial system, those can get kind of where they crisscross, and you want to try to get them to realign, because as they crisscross each other in kind of a webbing pattern, then you're not going to have as good of communication. As I mentioned in the intro, the fascial system is 6 to 8 times more highly innervated with nerves than the muscle tissues are. So as you get some improper patterning, as it starts to crisscross, then you're not going to have as good a communication, and you're going to have more pain. So again, just doing this thumb walking up through the tissue of the hamstring right now. I also will tend to do, especially as I get into the back muscles and tissue, I will do some gentle rocking exercises, or some gentle rocking movements rather, because this not only stimulates, but it also helps relax, interestingly enough. So again, just feeling for where there are areas of congestion. And trying to separate those fibers out. And once I get up into the back of the neck and particularly the epicranial tissue here, I will do more of a cross fiber patterning. So I'm actually moving the thumbs like this. And that will really help break up that tissue in the back of the head. Now, a lot of times I will do this with them face down on a massage table, and then when I have them turn over on their back, I will get the muscles or the tissue rather, is in the forehead that attaches at the brow. So that's just a little bit about how you can do massage to specifically the superficial backline, and be sure to watch part 2, which gets into exercises that help strengthen and or stretch the superficial backline. So until next time, have a great day.